Coming to the statistics, so till 23rd December 2020, there have been 76,382,044 confirmed cases of COVID-19, including 1,702,128 deaths reported to WHO. So, see how much of death happened and how many were the victims of this COVID-19, which make the disease significance more and more clear to you all. India reported its first positive cases of novel coronavirus on 30th June 2020 from Kerala in that Thrissur district with a student who was studying in Wuhan University. So, the index patient of coronavirus from India is from Kerala, and that is specially from Thrissur district, and it is being identified on 30th January 2020. So once corona being identified in India, what all changes happened to our country? On 22nd March, India observed a 14-hour voluntary public curfew at insistence of Prime Minister Narendra Modi. I hope you are remembering that Modi sir is being declaring a public curfew, and it was followed by a mandatory lockdown in COVID-19 hotspots and all major cities. And main lockdown, that is on 24th March, Prime Minister ordered a nationwide lockdown for 21 days, affecting the entire 1.3 billion population of India. So entire country become a collapsed, or in a state of a statue position the country became. The entire population becomes stuck in lockdown state situation from 24th March onwards, and in April 14, India extended the nationwide lockdown till 3rd May, which was followed by 2-week extension starting 3 and 17th May with substantial relaxations. I hope you are remembering all these aspects, as these situations we all were facing, and we were in like suddenly in overnight, as the Narendra Modi sir declared about the curfew and lockdown followed by a lockdown, all were taken home, and we were at home for a long period of time. And from 1st June, government started unlocking the country, barring the containment zone in 3 unlock phases, and that this unlock phase, we are in a situation of post-COVID phase. So you all are facing it, the situations, and we all have undergone the situations and scenarios what all happened during the corona season. So I hope you all getting a recollection about the aspects. India had tremendous capacity to deal with the outbreak owing to its vast experience in eradicating smallpox and polio. So for our country, it is not a first case. Initially, we had an experience with an outbreak like this, that is as smallpox and polio. So in June, India was ranked as 56th of 200 countries in COVID-19 safety assessment report by Deep Knowledge Group. So India identified the corona cases in our country, and we have made various activities to prevent the corona spread. Thereby, we have ranked to a safety position. The pandemic had left a severe impact on India's economy, leading to a negative growth rate for first time in decades. So, lot of severe impact happened, decline happened to our Indian economy. Nevertheless, the economy started to rebound after the lockdown was eased. So, India has emerged a world's second largest manufacturer of personal protective equipment, that is PPE kit, during this pandemic. So, that much of manufacturing production has happened to this PPE kit to prevent the infection spread, especially that is being provided for healthcare workers. So, and we are standing as a second largest country in the highest manufacturing of this PPE kit. Now, let us see in detail about the disease. So, coronavirus is an infectious disease caused by a newly discovered coronavirus, and most people infected with corona or COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring any special treatment. So once it come as a common cold or a flu, and without a treatment itself, usually it will get resolved off. But in case of older people and those with underlying medical problems like cardiovascular diseases, diabetes, and chronic respiratory diseases and cancer are more likely to develop to serious illnesses. So we are highly conscious and special care is being provided for the patients who are with these all conditions when they are affected with the corona. The best way to prevent and slow down the transmission is to be well informed about coronavirus or COVID-19 virus disease it causes and how it spreads. That is what I am still doing it, because we know how to prevent, we know how to slow down the transmission. More and more informations make you well versed in preventing the disease getting to you. COVID-19 virus spread primarily through droplet of saliva or discharge from nose when an infected person coughs or sneezes. So it is important that you also practice respiratory etiquette, that is, for example, by coughing into a flexed elbow if there is no kerchief or a hand towel or a mask with you. You can use this flexed elbow while you are coughing. Thereby we can prevent spreading of droplets into the air and thereby preventing COVID-19 spread. COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illnesses and recover without hospitalization. Now let us see the different signs and symptoms. Most common symptoms are fever, dry cough and tiredness. Less common symptoms are different body aches, pain, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on the skin or discoloration of fingers or toes. So these are the less common symptoms, and that will vary from person to person. But as usual we say, most common is the fever, dry cough and tiredness. Coming to the serious symptoms. Serious symptoms are difficulty breathing or shortness of breath, chest pain or chest pressure, loss of speech or movement. These are the serious symptoms. Non-respiratory symptoms of COVID-19 such as gastrointestinal symptoms like nausea, vomiting, diarrhea, neurological symptoms like headache, anosmia, fatigue, body aches may appear before fever and followed by lower respiratory tract infections like cough, shortness of breath, etc. So always you remember, or when you are giving advices to your family members or when you give health education to persons come around, always say that it's not the respiratory symptoms initially appear to a patient who get infected. First symptom is non-respiratory symptoms will come first, followed by the respiratory symptoms. So sometimes this patient may or the affected victim will have a feeling of body pain, tiredness, fatigue, followed by an episode of diarrhea or a vomiting. Then followed by the patient may have a cough and respiratory signs and symptoms. So that's how the corona infection travels. The children with COVID-19 may have fewer symptoms than adults. Suppose if the child is affected, pediatric population is getting affected, they may not have these many symptoms. They will be having only very fewer symptoms. CDC is investigating multi-system inflammatory syndrome in children, a rare but serious complication associated with COVID-19. CDC recommends monitoring the children for worsening of COVID-19 illness. So usually when we say COVID-19 illness is not complicated in children, but in very rare cases it may cause multi-system inflammatory syndrome which make the child to be very complicated situation. So that is very rare, but you should know that if it is affected with severe complications, then the child has to be immediately hospitalized and further care has to be taken. Otherwise, we may lose the child. So, to prevent that, we have to monitor the child with COVID-19, whether the child is reaching to any kind of such complications. So, major symptoms based on the percentage, we can see fever is the major one, that is 87%, dry cough 67%, dyspnea 18%, diarrhea 3.7%, sore throat 13.9%, and ventilator use 4.1%. So this is how the frequency or how frequently the disease is affecting the individual with the signs and symptoms. I hope till the symptoms you are clear with. So now let us move on to the diagnostic features. We'll see in the next slide.